now we're going to see aneuploidy screening. So we have several ways to do aneuploidy screening. We have a cell-free DNA testing. We can measure maternal serum alpha fetoprotein. We can do what is called the combined test and the full integrated test. So we're going to see each one of these in detail. Cell-free DNA testing. This is a non-invasive test which we can do around 7 weeks gestation or after 7 weeks gestation. Here what is done is we take DNA breaks that are floating in maternal serum. So let's say here is the blood of the mother, and several times during pregnancy could be a mixture of fetal cells going into the bloodstream of the mother. So here let's say we have some fetal cells coming into the bloodstream of the mother. Here is some DNA breaks of fetal cells. So here we are taking a blood test of the mother, not of the fetus. If it would have been a testing when we need to draw blood from the fetus, this would be an invasive test for the fetus. But this is we are taking blood from the mother, and here in the mother's bloodstream, eventually we will have some DNA breaks. And these DNA breaks, we do karyotype of this. We do a karyotyping of this, and then we can determine if we have an aneuploidy, for example, 13, 18, or 21 aneuploidies, which is Plateau-Edwards and Down syndrome. We can also evaluate for sex chromosomes disorders, and we can evaluate for the sex of the fetus. This is one way to screen for aneuploidy. After finishing reviewing all of the other tests, we're going to see the indications for cell-free DNA, because even though this is a test we can do even at 7-week gestation, this is not normally something that we do. The maternal serum alpha fetoprotein. This is the fetus is producing alpha fetoprotein, and this enters to the mother's bloodstream. Alpha fetoprotein, this peaks at 12-week gestation in the fetus, but in the mother the peak is at 30-week gestation. Even though the maternal serum alpha fetoprotein test is done between 15 to 20 weeks gestation. So this is during the second trimester. And here we are measuring the levels of the alpha fetoprotein, which is produced by the fetus, but in maternal serum. And the normal value of this is between 0.5 to 2.5 multiples of media. So this is not an absolute value. This is multiples of the media. So whatever be the normal media of of alpha-fetoprotein in maternal serum between 15 to 20 week gestation, whatever that be the median. Then we take an average and a multiple between 0.5 to 2.5. Then that is what we call the normal range. If we have a result that is less than 0.5 multiples of median or greater than 2.5 multiples of median, then this is an abnormal test. This is an abnormal test, and the next best step, or what we do, even though it's less or greater than the normal value, is to do an ultrasound. So we need to confirm gestational age with a transabdominal ultrasound. So let's suppose we do a test and the alpha-fetoprotein was greater than 2.5 multiples of the median. So there are two reasons for which the result could have been greater than normal. One is that we have a dating error. So this is if we take the normal value, for example, at 18 weeks gestation, whatever it be, and the result was higher than the normal at 18 weeks gestation, that abnormal result could have been because we have a dating error, and indeed the patient is not the gestational age we are considering, which is 18, but maybe she has a greater gestational age, and so we need to correct that. How we are going to evaluate if we have a dating error? That is going to be with a transabdominal ultrasound. The other way around, if we have a result that is less than the normal value, for example, let's suppose we said the patient is 16 weeks gestation. So we take the normal value at 16 weeks gestation and we take 0.5 to 2.5 multiples of that normal media value, and if it's less than 0.5, we will say this is abnormal. But this could be abnormal because of a dating error. Maybe she is not 16 weeks pregnant, maybe she's less than 16 weeks pregnant, and so the normal value we took and to whom we then did the normal range is not accurate, because we assume 16 weeks, but maybe she's not 16 weeks, maybe she is 15 weeks, and so we need to take another media, the media for 15 weeks and not 16 weeks, and then do the 0.5 to 2.5 multiples of the media. So being less or greater than 0.5 to 2.5 multiples of the media, this could be a dating error, which we are going to confirm with a transabdominal ultrasound. If the result of the gestational age with transabdominal ultrasound is correct, so this is not a dating error, and so this is abnormal. If this is abnormal, for example, if this is higher than 2.5 multiples of the media, then we can combine the maternal serum alpha-fetoprotein test with amniocentesis. This is because when we do amniocentesis, which is an invasive test, then we do karyotyping of the DNA of the fetus, which is an invasive test. If it is the case that the alpha-fetoprotein in the maternal serum is greater than 2.5 multiples of the media, then we we, besides doing karyotyping, we also order acetylcholinesterase, which is specific for neural tube defects. So if this is higher, this suggests neural tube defect. If it's less, this could suggest aneuploidy syndromes, for example, 18 aneuploidy, which is Edwards syndrome, for example. So another way of evaluating aneuploidy is measuring maternal serum as a phytoprotein. If the result is on the extremes of the normal range, then we need to evaluate the gestational age with transabdominal ultrasound. If this is correct, then we do amniocentesis to evaluate the possible aneuploidy. Next is the combined test. Here this is a combine between serum and ultrasound test. So here we have a transabdominal ultrasound which we want to evaluate for nuchal translucency. Which this is the one of the highest or most relevant characteristics of Down syndrome, for example. So this is an ultrasound to evaluate anatomical structures, plus serum or laboratory studies. Here we combine the maternal serum alpha-fetoprotein and we also combine the pregnancy associated protein A or PA, pregnancy associated protein A. So here we are going to detect signs of aneuploidy based on this anatomy ultrasound and abnormal results of maternal serum alpha-fetoprotein and associated pregnancy associated plasma protein A. And the full integrated test, this is we do the quadruple test, which is for maternal serum values, which is beta HCG, inhibin, unconjugated estradiol, so remember that we measure the beta HCG at the beginning of pregnancy. Here when we are doing the quadruple test, we again measure beta HCG, inhibin, and unconjugated estradiol and alpha fetoprotein, which is the one we're talking about here. Alpha fetoprotein. This is the quadruple test. For example, if all of these values are decreased, this suggests Edward syndrome or 18 trisomy. Quadruple test plus the pregnancy associated plasma protein A. So now we have the quadruple test, which is all these 4 serum labs, plus this one, which we had in the combined test. This is going to be the full integrated test. Plasma and pregnancy associated plasma protein A plus the quadruple test and an ultrasound. So these are the several ways we can screen for aneuploidy. We can do it we can evaluate it with cell-free DNA testing. Now these, even though we can do it at 7 weeks gestation, normally we do cell-free DNA testing only if the patient or the mother has more than 35 years, if she is greater than 35 years old, or if we have an abnormal ultrasound, for example having a nuclear translucency, or if we have an abnormal maternal serum alpha fetoprotein, or if we know that the mother or the father had a Robertsonian translocation. These are indications to do cell-free DNA testing. Otherwise, we normally do not do that. Maternal serum alpha fetoprotein test is done between 15 to 20 weeks gestation, which corresponds to the second trimester.